Hi, my name is Dr. Carmen Izquierdo. I'm a board certified family physician and geriatrician, and today we're going to talk about aging. Now we see it, we feel it, but what truly is going on? So, aging is a gradual, lifelong process. It does not occur overnight, and it's going to begin internally at a cellular level, and we're not going to be able to see it necessarily, but we start aging since our 30s at different in different types of elements. Now, it influences every organ system. The skin is the largest organ, so we're going to see visible aging changes early on, wrinkles, sunspots, among other things. But that's not the only thing that's going on. It's going to also affect how our brain works and how we move and function, and we're going to learn about that a little bit later. And it's going to be also shaped by our genes, on our environment, and our lifestyle. Now, we mentioned, getting a lot of sun and the UV damage and how it affects skin related aging, but there's also pollutants and chemicals that are in our everyday household products, maybe work exposures that are also going to influence our cells and how they repair and help us deal with stress and illness. And then there's lifestyle, which includes being physically active or sedentary, and the types of foods that we eat, and that has also been linked to many conditions that affect aging. Now, why do we age? There's cellular damage accumulation, as we mentioned before, but there's also decline in our ability to repair itself quick enough, in terms of what we're dealing with. There's inflammation related to our foods and our environment, as well as our diet and our chronic conditions. There's oxidative stress. There are hormonal changes, and we've heard about menopause and testosterone changes. I think that's very mainstream nowadays. That also plays a role on how we store fat, how our body is able to deal with everything that's going on, including how we detox ourselves. It's not the same. I think a great analogy is that the people who drink said, when I was 20, I could drink 5 beers and nothing would happen, and I would wake up fine the next day. But if I do that at 40 or 50, I don't get a good sleep and I don't feel the same the next morning. And that's an example on how the hormones and our organs are aging, and they're not able to deal with the same types of stressor anymore. And there's also genetic programming and instability, which are other more complex mechanisms that impact how we are aging at a biological level. Now, what I want you to think about is that, again, aging is occurring in more than one place at once. We talked a bit about the physical components, that what we see, but at a biological level, it's the process that's aging our cells and our organs. So again, how their ability to function well. And then we have the cognitive dimension. So this is how our brain works. Our brain is like our body's computer. So if we have impaired cognitive abilities, then we won't be able to execute our functions well enough. So we see this in patients with dementia, for example. They can't speak well, they can't function well, and it's because of their impaired cognitive abilities. And then we have the functional domain. This is how our body moves, our balance, our ability to walk, and to deal with day-to-day tasks. So when we see impairment in these, then we have slower gait, we have difficulties with balance, and we might even fall or have functional disabilities. And this should always be a red flag for seeking medical attention. Now, our social dimension, it is basically our ability to communicate and interact, build relationships, and be socially appropriate. So if you see someone who has had an abrupt change in personality, who is seeing things that are not there, talking about things that are not there, being withdrawn or isolated. Now, this is also a red flag for seeking medical attention, because isolation has been linked to depression and to dementia and to other medical complications. So it's something that we need to, again, work on if we want to have a healthy aging process. So what is the difference between aging and disease? This is an important question because aging itself is not considered a disease, and that's why we don't have technically a developed drug to beat aging, because there has been a lot of growth in terms of trying to interfere with the aging related mechanisms at cellular levels. And there are interventions that we can do to help with, for example, gut dysbiosis, that basically our gut flora changes as we age. So we take probiotics, for example, but there is not a targeted therapy, a miracle drug that can really stop the aging process. Not yet. We have a lot of new modalities out there, but that's not the focus of today's talk. But aging itself, again, it's a slow process. It's predictable. We have data about what goes on each decade. But if we see someone who we love with accelerated or abnormal abrupt changes, then we need to have medical evaluation. So again, healthy aging, we get slower as we age. This is true, but knowledge should be stable. We could learn new information. It's just gonna take a bit longer. We might need to use certain mechanisms, such as rereading the same information over and over, or writing down key elements, but it's not impossible, and it's actually one of the ways that we can actually help maintain our cognitive abilities, just trying to learn new information. There is gradual muscle loss, surprisingly enough. About age 35, we start losing muscle, and then in each decade it gets worse. And that is why we need to build exercise plans focused on strength training to help maintain and build muscle, so we can also build strong bones. If we don't do that, then we get osteopenia or osteoporosis. We get weakness, we get problems with gait, we get falls. So again, this is one of those early pathways where we want preventive interventions so we can avoid that. We also have slower gait and speed, as well as recovery time. Now, we talked about cellular aging. So one of the mechanisms that gets impaired is the immune system, right? How we defend ourselves against illnesses and stressors. So it might take us a bit longer for us to recover us from a common cold, or if we get hospitalized, then we have weakness after the hospitalization, and that's part of the normal aging related process. But again, if we see an acute or significant decline, then we need to have additional medical intervention. So let's talk about pathological or unhealthy aging. And then again, a red flag: rapid, abrupt changes. And this can be in any of the 5 domains we talked about, either functionality, social changes, or unintentional weight loss. This is very important. If we don't have significant interventions early on, we might have a lot of nutrition related issues, and this can be expressed as unintentional weight loss, significant muscle mass loss, weakness, and that can lead to a lot of additional cascade of problems, such as falls or cognitive related problems. If we're losing independence, for example, if I had someone who was able to balance their checks, do their grocery shoppings, manage their medications, and they're unable to do it anymore, then again, this is someone that needs a medical evaluation to really pinpoint what's going on. And this is one of the areas that is usually impacted by dementia. When we have a loss in our cognitive abilities, we are going to lose functioning. So it's something that always warrants a medical evaluation. So can we influence aging? Yes, we can. It is shaped by strategy, not luck. As we mentioned early on, it's not only a genetic issue. We can change our environment to an extent, and we can change our lifestyle, and we can do interventions to really help us shape a healthy aging process. So how can we build health span? How can we age in a healthy way? Well, there are 6 areas that we need to work on in order to have a healthy lifespan. So we want to work first on medical management. Now, you need to do this with your provider, with your medical provider. If you have uncontrolled diabetes, hypertension, or chronic heart disease, all of these are going to contribute to quicker aging. They're going to contribute to inflammation, and they're going to contribute through aging in all of the domains. So if we don't control our medical part, then the rest of it is going to fall apart. What other elements we need to work on are physical activity. Inactivity has been linked, being sedentary, spending most of your time in a chair or a bed, has been linked to a lot of health problems like, high cholesterol, high blood pressure, heart disease, to name a few. But if you are physically active, there are certain types of exercises that has been linked to the opposite, helping you lowering your risk of stroke early on, helping you beat cognitive changes. So, maintaining physical activity is very important on many levels. We also have the benefits of helping you maintain and build muscle, as well as maintaining your bones strong so you don't develop osteoporosis or even fall and fracture yourself. Nutrition is a very important topic as well, because we have different types of diets out there and we use them for medical interventions and treatment as well. And many of them, and having a diverse amount of food, can help us with many medical problems that contribute to, again, aging at a cellular level. Now, sleep is also an interesting topic. We're going to have some aging related sleep changes, difficulty falling asleep, maybe waking very early in the morning. And we need to start developing a sleep hygiene routine, which is healthy habits to help us sleep better. And sleep is very important because it's the only moment in the day where our body is trying to repair all the damage and to restore itself and help us build resilience to any type of stressor out there. So sleep is very important, and when we have poor sleep, it has been linked to other chronic illnesses. So it's usually one of the problems that it's within the cascade of geriatric problems. Social connection, I mentioned a bit earlier about the risks of isolation. So it is important to get ourselves out there. And if we can't physically, we don't have a car, we don't have the means to do it, then just talking to someone over the phone, talking to your neighbor, it's the social connection is so important to really foster some parts of your cognitive health. So it is one of the things that we kind of lose unintentionally, and we need to do an intentional effort to keep fostering. So if you have sons or daughters, so if you have grandkids, it's important to just be with them, especially kids. If you have younger kids, playing with them does such important role to really supporting brain health in different ways. That is very important. Now, cognitive stimulation, this is one of my favorite topics. So we need to think about the brain not only just as a computer, but as a muscle. If we don't work on that muscle, then we lose our ability for it to function. Same as so cognitive stimulation is doing different types of activities that are going to support brain health. Now, I mentioned the social connection as part of the areas that we need to work on, but there are many different ways that we can do brain stimulation or cognitive stimulation, and it has to do with different elements: learning new information, reading, doing puzzles, things that involve logic and problem solving, just like Sudoku, for example, crossword puzzles. We can also do different types of hobbies, just like gardening has good evidence, cooking has good evidence as well, because we need to follow complex instructions, we need to follow steps and execute them. Cooking can also help us with the social connection and different type and nutrition, so we can link different elements there. So these are basically 6 of the areas that we need to work on to build a healthy aging process and really contribute to our health span. So takeaways: aging is driven by multiple interconnected processes, just not the skin, it's just not one organ, it's the whole body that's aging at the same time. That is why on geriatrics we focus on seeing the patient as a whole, not a disease, not a body part. We need to see the whole picture just to get a clear idea of what's truly going on. Remember, lifespan is not the same as health span. Lifespan is just the amount of years you have lived, and health span is your healthy years. And understanding how aging works really can help families and caregivers support and live more independent lives. So I hope you learned a few important things, and you will like and subscribe this video.